This is Wellness by Designs, and I'm your host, Andrew Whitfield Cook. Joining us today is Jaxson and Hilary Conroy, both chiropractors and applied kinesiologists, and today we'll be discussing health and well-being through the lens of the Triad of health. Welcome, guys, to Wellness by Designs. How are you both?
Thank you. Yeah, we're great.
Thanks for that. Yep, really good. Thanks, Andrew.
So because you're chiropractors, you're both used to, quite hardcore medicinal diagnostics and treatment paradigms. What's so different about your treatment philosophy that you've embraced?
Yeah, so the difference being that we've just added in a couple of dimensions to health. So both of us have had our own realizations along the way, working with patients and also being patients ourselves, that just looking through the lens of the physical body isn't enough. And oftentimes there are biochemical or emotional aspects to people's health, and even biochemical and emotional aspects to the breakdown of tissues or the production of symptoms, signs, and conditions. So that's what's led us down the track of integrating applied kinesiology with chiropractic and using that on our patients.
Gotcha. Hilary, anything to add?
Not too much to add from that. It's just rather than coming in nice and close to the problem, we take a much broader lens so that we have the bigger picture, because the bigger picture is underlying the hows and the whys the tissue was able to get to that state in the first place. Yeah. One thing that used to stun me when I was nursing is they'd talk about preventative medicine. And it was never, ever preventative medicine. It was early intervention. Really interesting concept and definition. But so when we really do look at embracing holistic medicine, it really should be encompassing all that we can do, but also all that patient needs, whether it's from us or some other practitioner. It's a really interesting concept that isn't well grasped.
Yeah, that's right. And I think, not all of us practitioners have had, the structure or the foundation to look at that. And I love what you say about preventative care being also early intervention. It makes so much sense as well. And having tools that are sensitive enough to pick up on things before they turn into anything is, life-changing for a lot of people.
Yeah. Well, let's discuss these lenses. So what exactly is the Triad of health?
Yeah, so the Triad of health essentially is just the tool or the explanation we use to speak about how our body is made up of, obviously, our structural components. So we have our bones and our joints and our muscles and our nervous system. And it's also made up of our chemical components, the big chemical soup that we are as humans, our nutrition, our hormones, our gut function, all of that kind of stuff. And thirdly, our emotional health. So how our body copes with stress day to day and how it's able to process what we go through in such a way that allows us to grow and heal.
It's almost like a duh moment. It's things that we know, isn't it? But how often do we see, I just saw it the other day in a patient, how often do we see one specialist not talking to another specialist? And so the patient's ailment is compartmentalized to a point where there's no communication even between the health professionals.
That's exactly right. It's such a good example of how disjointed we've become when we look at patients, rather than looking at them as a whole being with all these different aspects. We have kind of gone down the road, especially medically, where we've sort of even just divided people up into their 5 fingers, and looked at each one individually rather than it being attached to the hand. And we see it all the time. And You know, we make an effort to try and connect people with the right people because it's right. Like we look at things through our holistic lens, but there's also so many referrals and so many things that can be done outside of what we do as well. And it's important to remain interconnected. It's like complementary and integration and a comment on all that too.
Yeah. Hilary?
Yeah. It's, as you're talking about this, I'm so reminded of how we've moved through society from our roots thousands of years ago to being so connected to the earth and so connected to each other. And then as medicine has developed, it's kind of shrunk down and into its smaller components and become very disconnected, very mechanistic. And what we're finding now is that, you know what, great for saving people's lives. That's so good. But when it comes to healing a whole person, we need to look at the whole person and we need to be able to identify what's missing, what kind of help do they need, and who is the best person for those different parts of each person. So it's kind of like from coming out to in to slowly coming out with greater awareness, I think.
Yeah, absolutely.
And the community.
So let's delve a little bit into this lens. So, you know, you trained as chiropractors, but then you've learned applied kinesiology. Let's talk about how applied kinesiology can help, and indeed the cautions that we have to be aware of with applying that. How important is it to treat holistically, and how often does kinesiology change your clinical suspicions?
Yeah, so applied kinesiology is the tool that we've used to integrate into our practice to be able to have access to holistic healing, right? So with our chiropractic degree, we have an amazing background and excellent foundation in common conditions, biochemistry and all that, but to apply it properly and to open our scope up from just treating the physical body to also assessing and treating the biochemical body and the emotional body, we have used applied kinesiology. And applied kinesiology is the use of muscle testing techniques to measure the change in the nervous system or the tone of the muscle that's controlled by the nervous system as it responds to different stimuli. So those stimuli might be physical stimulus, it might be using different biochemical markers, it might be using different words or semantics to bring up emotions, and also muscle testing anything that the body kind of has. And so it kind of really opened our scope up and allowed us to see more of the patient and the underlying processes that were going on for them. And what we found was in almost every person that walks through the door, regardless of their condition, that there always seems to be a physical, chemical, and emotional aspect to their condition. And so when we have that, so we've developed the tools and we've integrated a lot of different protocols so that we can actually apply therapy, which will then change the muscle test so that we know it sort of works. So the muscle test turns into this kind of continual measuring device that we can use to track the changes in the body as we're applying therapies to see what's working or what isn't working or what's affecting that person, and then what's also going to be good for them as well. And there are plenty of biases that we can have with kinesiology, right?
Yeah, I mean,
be mindful of.
I think the first thing we learn when we learn how to muscle test is how to do it properly and how to be so neutral in the way we read the muscle test. Because it is so easily influenced. You can kind of make a muscle do whatever you really want it to do with the wrong intention. And so it is about being very clear and clinical and taking your ego and your preconceptions aside to get the right answer. Because I think, you know, the other part that you asked in that question was how does it change what you think clinically? How does the kinesiology change how you perceive what's going on for your patient? And I mean, I've had so many so many moments through treatments where all of my clinical knowledge and expertise points me down a direction. This is thyroid, this is small intestines, this is a parasite for sure. And the muscle test will take me in a completely different direction. And I've just got to kind of trust that and then further back up whatever I find with the muscle test.
Yeah, that's the beauty of the muscle test. It's so easy to bias it. And that's kind of the beauty of it, because it's so tuned. It's the person's body that you're assessing with their own muscle. So we can't really project our own expectations onto that. We are more in a receiving or listening place to hear sort of what the body is saying to us through the test. And that's why it's so powerful to use, because we're just testing that person and their unique system rather than trying to sort of interpret through our sort of lens. So in that way, it becomes this really powerful tool where it's just it's almost like if that person was their own doctor, they're able to sort of bring that information to us. Yeah.
Okay, that's fine from the patient's perspective, but just to take it back to a couple of medical examples, like number one, I can remember nursing back in the old days when blood glucose testing monitors used to have two gauges, like VU meters on your stereo, right? Two little needles.
Yeah.
And you had to do the correct control and then priming and washing of the blood. And if you didn't do that correctly, then you had user interference, user created error for the reading for the patient. Second one was, if you wanted to go recently, we've learnt, these robotic surgery devices can be either fantastic, or if you get somebody who isn't quite competent at that, you can have extremely bad botched operations. We've seen examples of this. So there's another user error. You see it in flight, accidents all the time, in passenger airline accidents, flight user error, all of that sort of thing. So again, it really does come down to I don't want to say a glib term, but how centered the practitioner is, and how willing they are to let go of ego and just be present for the patient. That's fraught with error. I've seen countless examples of arrogant practitioners and people who know it all and all that sort of thing. How on guard do you have to be, therefore, to your own self, your own issues, before you can be there for the patient?
That's such a good question, an amazing question, because I'd say that's a daily practice. And it's been about being aware of what my expectations are and why. And, as a practitioner, we all have a real strong desire to help people. We want people to get better. We want to fix them. We can all feel insecure in our practice, especially, with applied kinesiology. It's not exactly fully accepted and integrated into the medical and chiropractic community anyway. So we're using something that's a bit different. And so it's a constant practice. And I think that's the beauty of it. And there's some research that's been done on people who have been trained in applied kinesiology, and somewhere between 2 and 5 years, the expertise level just develops to a point where the margin of error is much lower. And I think that's got a lot to do with, one, developing yourself as a practitioner and, getting good at muscle testing and listening to the body and understanding what's coming up. But I also think it has to do with the fact that even if you project something onto the patient that you're muscle testing, it still doesn't always go in the right direction. You still always kind of, the muscle test just doesn't quite stick. And that particular substance you're testing, or body part you're testing, or therapy you're applying doesn't quite work. So, even if you're still doing it and you're not aware of the bias, you're not going to get the results that you desire. So it's been an interesting journey working with this tool. But the results, have been great.
I will just add, I'll jump in for a second and add, there are certain tests with kinesiology that are kind of like checks and balances. And so it's never just a singular muscle test, which will give the ultimate treatment or the ultimate diagnosis. It's always backed up to make sure that whatever we're prescribing or whatever is showing up for the patient is really there. It's never just that this one thing happened and so this is what's wrong.
Gotcha.
Yeah, it's painting a diagnostic picture. Yeah.
Yeah, so you cross-reference it basically.
Absolutely.
You got to.
With also further testing. We'll send the patient out when we need to. Yeah.
Right. So this was going to be my next question about have you particularly if you're using kinesiology has taken you on to another strain, another direction of causation of what the ills would be. Do you ever back that up and go, this is showing up and it's weird. Let's validate that with orthodox pathology testing or something like that.
Correct.
Oh, right. Absolutely. Yeah.
You have to.
And not just that, I mean, it's so good for patient education to correlate results so they can see it as well on a piece of paper. And not just that, sometimes it just helps us round out what we need to do for them. Or we can call in, because we have a collaborative practice, so we can call in other professionals to help us out, or we can send them to the right person. I don't know, it just opens up. It's an amazing part of practice is further testing.
But it's also, if you think about where the future can lie for applied kinesiology, why am I stumbling over that? And that is to once you get this validation of a concordance with orthodoxy, then your gold standard is confirmed by kinesiology. That's huge for the future of kinesiology. Because if we can get papers out there saying this and showing, yes, there's concordance with this when you do applied kinesiology, then that will hopefully one day lead to validation. Because this has always been my bent.
I even think there are studies like that. But I mean, it is one of those particular tools that can be difficult to evaluate in more conventional research ways. So, yeah, it's a work in progress. There's some really amazing people in the ICAKA, which is the International College of Applied Kinesiology, Australasia. And they've been pumping out some papers and things like that and some really good stuff coming out. Yeah.
Good stuff. Okay, so now let's just say honing in on an issue that's not really, well, we say not related to, but it is. But let's say not traditionally thought of as being under the realms of chiropractic, and that is gut health. So if we looked at how applied kinesiology can help your patients who might present with, let's say mid-back pain or leg pain, gastrocnemius pain, for instance, and we can tie that back into a link with gut pain, with gut dysfunction. How do you utilize kinesiology in that instance? Like, what sort of testing would you do?
Do you want to take this one?
Yeah.
You want me to start?
You start.
Hey, I was just making sure I don't talk too much. I'm just like jumping.
We both have a lot to say.
So where to start? I mean, the first thing is it's been shown in the research that, and clinically as well, that the low back and the bowel, large intestines, are associated. So the low back pain is commonly associated with ileocecal valve dysfunction and large intestine issues, bloating, inflammation in the gut. It's common that autoimmune conditions that are centered in the gut, like Crohn's disease and ulcerative colitis, can contribute or be correlated with a condition called sacroiliitis, which is inflammation of the SI joints, causing low back pain, inflammation, nerve pain down the leg. So it's quite, I'd say in clinical theory, in our circles, it's quite well known that the lower back, if someone comes in with lower back pain, you've got to check the gut, right? Because they're so closely related. But when it comes to mid-thoracic pain, headaches, or other physical symptoms or conditions, knee pain, the stomach, small intestine, liver, they all contribute to dysfunction in these areas. And this is, in kinesiology, it's quite a complex relationship. However, it's probably easiest talked about within two frames. The first one being that every muscle in kinesiology has an organ relationship. So if an organ's in trouble or one of the organs is inflamed or in dysfunction, swollen, whatever, dealing with an infection or whatever, then it's common that you'll find that the muscle associated with that organ is weak. And so during our assessment, as we're testing muscles, if a particular muscle is weak on both sides, has to be bilateral, then we'll be alerted, from our education that we should check that organ as well. So for example, the popliteus muscle, which is found behind the knee and is a primary stabilizer for the knee, that is associated with liver and gallbladder. And so if people come in, which we see a lot of patients with bilateral knee pain or bilateral knee dysfunction from whatever, then we will be alerted to muscle test the popliteus and then check the liver if it's weak. The other way that we view the connection between the two is if there's a gut dysfunction anywhere in the gut from the esophagus all the way down to the rectum, there are these nerve reflexes called viscerosomatic reflexes. So from the spine to the organ, there are reflexes that if the viscera is talking, so the stretch reflexes are firing, or if there are nociceptors, they're firing, except they're usually on the membranes on the outside. Or if there's any kind of trouble in an organ, it will sort of travel back to the spine where its nerves originated, and then whatever part of the spine that is, the muscles that somatic nerve innervates, they will start talking. Or you can get patterns of pain as well. And so you get these kinds of patterns in the body through these viscerosomatic reflexes too, which is a great way to link the spine and organs together.
Yeah. Hilary, anything to add there?
Yeah, I think, in the context of the gut and kinesiology, just exactly what Jaxson said. He's said it really well. I would say that the biggest thing in clinical practice linking the two is being able to communicate that with a patient. Because, for example, if you have someone coming in with chronic low back pain, they've got an inflamed disc, they've tried every manual therapy and, nothing's worked. And we've picked up, actually, you've got, large intestine inflammation for whatever reason, and there's no way your back pain's going to go anywhere. It won't matter what I do mechanically to your back. Unless we address your gut, we're not going to get anywhere. And so I guess really just being able to explain to the patient the connection, like Jackson's just said, between your viscera and your body, your skeletal, your musculoskeletal body.
Well, we see, you know what's interesting is, you'll get naysayers, and I'm like an open skeptic myself, but you'll get naysayers who will just go, no, it doesn't exist. But hang on, we already accept referred pain from the gallbladder to be shoulder tip pain. That's accepted orthodoxy thing. Yeah. We've already elucidated just recently, like within the last, say, 5 years, that there's these mini brains in the peripheral nervous system, which we never knew about. I mean, it's only been 6 months since they elucidated these new sinuses. What the? Like, nobody's ever thought. So we think we know all about the human body, but we're still learning even about the anatomy of the human body, let alone the physiology. So part of this thing about this, that some things are accepted. What's another one? When you've got referred pain along the
cervicogenic headache.
You got it, cervicogenic headache. But referred pain along the dermatomes, TFL, referred pain from ovarian cancer, blah, blah, blah. There's already these accepted things.
Yeah.
But these other things are dismissed automatically out of hand without saying, well, hang on, what could be the relationship? That's where the interest for me lies.
100%. I mean, I think that it's really dangerous to just completely shut out a perception especially when it comes to treating patients. And I think it's so important to stay open, especially as a clinician, because we don't know everything. And but what we do really understand, quite everyone would really understand this, is that every single patient is very unique and very different, and they use different, their body makes their medicine, and they use different compounds to, treat their own issues and stuff like that. And so, it's up to us really to be able to assess someone appropriately and to apply the right therapies. It's up to us. It's negligent not to, and it's negligent to dismiss, because what we're really doing is we're dismissing a patient's reality. And that's essential to the healing. And I think we've lost touch with that a little bit. And when I was going through chiropractic school, I was a researcher. I was a very healthy skeptic of anything that sounded a bit out there. And what struck me was that I've lost my train of thought. What did strike me about that? What was communicated to me from this evidence-based practitioner place was that we use the evidence we have and we stick to it and we don't dismiss that. And then anything that is outside of that scope that we don't yet understand, we pull on our education, current events, current research, and other mentors in the community. And we also pull on our clinical perception. So we're in the room with the patient, and what we're seeing and how we're interacting with that, it also has information. And so I kind of pull on that a lot when it comes to naysayers and skeptics and stuff around using applied kinesiology to assess someone, is that I'm like, well, this is the stuff we don't know yet. And this is the stuff we don't have a lot of reliable tools to measure. So I'm going to use something that I know I can use well and that I'm always checking, and cross-reference as much as I can to get as much information about this person and what's going on for them as possible, so that I can apply or help them find what they need to improve themselves.
Gotcha. Hilary, what's been your experience from learning about, the sort of hardcore pathophysiological process to checking with patients and things like that?
Look, my experience is just that we are such complex beings, and I'm so grateful for my medical background in terms of all of the education I received from university. It informs my practice, obviously, daily and immensely. But there's so much more to health, and the triad of health is always going to be the lens for me to address each and every one of my patients, because it's the most responsible way for me to do that. If I have someone coming to me and they're in immense pain and they've tried everything except somatic healing for emotional pain, I feel bound to help that person where I can in my clinic with the tools that I have, and to send them on for the right kind of care for that component. It just creates much more of a whole picture, And I think it covers more realistically who we are as humans living this human experience. It's a no, for me, it's a no-brainer. Yeah.
And I think it expands on, you know, we have all this medical information and we have all this great education, all these great research. And I think applied kinesiology just allows us to put that to practice. It's a tool that we can use to actually apply functional health to people's, you know,
you know what? I was actually thinking about this just the other day, and I was thinking, and forgive this stereotypical explanation, it is, but in the olden days of nursing, and you know, we see it in medicine and things like that, you know, you came across the arrogant professor, and in actual fact, I've seen very few of these arrogant professors. I've one or two. Most of the professors that I've actually seen, and this is how I was differentiating between a professor, one who professes, and an expert, one who is truly into what their specialty is. And that is that the professor just wants to tell people, whereas a true expert delights in being surprised by new information and going, that's awesome, where can that lead? That doesn't fit with anything I've done before. That's so exciting, rather than automatically shutting it down and saying, that doesn't gel with my paradigm, so therefore it can't exist. It's what I did. And I'm not a professor, but I was that person. I was that. It can't exist, therefore it won't exist, therefore it doesn't exist. But the people that I've met through podcasting and all these conversations I've had are these people who delight in new information. They will never shut it out. They'll test it. They'll be skeptical about it, but they won't shut it out. They'll see where it lies. Can I ask just one last quick question? And that is, I can truly see your care for your patients. I get it. Your devotion to your patients is overwhelming. It glows from you. But I have to ask, from a purely business point of view, you've got to invest a certain amount of time by checking, cross-referencing, making sure that you're on the right track, and then even suspecting and saying, am I on the right track? So then you've got time, and you've only got a certain amount of time per patient. How does applied kinesiology and looking through the lens of the triad of health, how does that affect per patient episode versus time?
What can I? Yeah, I'm going to jump in.
Please do.
It's actually super time effective.
Really?
Because
once you've got the expertise, right?
There's a lot less guesswork. I'm not like, oh, I wonder what is going on with you. I'm going to ask your body, what do you need? What is your body missing?
Right.
Exactly how can I help you? And the proof is in the results, ultimately.
Right.
So I expect results quickly, not to be egotistical, but if I'm on the right track, I'm going to see a difference. And I'm not going to waste time doing the same thing without a result. And so we've refined our skills in the room. We're very time effective. We're able to get a lot of information out, and we're able to prescribe what we need to prescribe really effectively within that space. But because our feedback comes from the patient, if they're getting better, we're on the right track, and things are happening a lot quicker than perhaps what that would have for them in the past. If it's not progressing in that way, we're always going to ask why. We're not going to do the same thing over and over again. We'll do a different approach, whatever we need to do. But I must say, the results that we get in clinic when we apply the triad of health are very time effective.
Yeah, we've really had to create a lot of protocols and design. If a particular thing does come up, well, then how do you? What kind of therapy is really good for that, and how do you clear that, or how do you move someone from being in that state to this state? Within the time frame that we have in a consult. We also, we had to learn a lot of business skills, like how to schedule appropriately, how to create treatment plans for people, how to give them the right expectations, and work together as a bit of a team with the patient. And that has helped a lot. So,
Yeah. Guys, as I said, I can plainly see that you hold your responsibility for the health of the patient in the highest regard. Indeed, I would say more than patients. I'm going to go one step more and go society, because you are already there. You're already looking outside of just the person in front of you, but how they interact with their family unit and others, their significant others. So well done to you. But it's also telling about how you view your responsibility to their health. It's not just this sort of a little business sort of, how do I say it properly? It's not like a business tool that you're referring this applied kinesiology to. It's actually like truly heartfelt responsibility and care for that soul in front of you. So well done to you. I applaud you,
thank you
for looking further than what a tool can do, but how you can help that person in front of you. Well done to you both.
Thanks,
so
Andrew.
Much.
And thank you, everyone, for joining us today on Wellness by Designs. Remember, you can get all of the show notes for today's podcast and the other podcasts on your favourite podcast app, and, of course, the Designs for Health website. I'm Andrew Whitfield Cook. This is Wellness by Designs.